We're going to look at the axial skeleton. Now, some of this, as a disclaimer, I'm going to go over somewhat quick. If it feels quick, that's okay, because a lot of this is a lab thing, where in lab you're going to look at the bones, gross anatomy, but we'll review some of that here as well. Okay, the body is broken into, the skeletal system is divided into two parts. The axial skeleton that you're seeing here in green, and the appendicular skeleton that you're seeing in gold yellow color. I do want you to be able to identify bones in the axial skeleton and appendicular skeleton. For example, if one of the test questions says, of the following bones, which ones are found in the axial skeleton, and then I give you a list, be able to choose which ones are found in that axial skeleton or appendicular skeleton, depending on the way the question is worded. Okay, do go over the list that you have in your lab syllabus on the skull bones that you need to know. We're going to go over a lot of them here. Okay, now for starters, I do want you to know that the orientation of the bone itself can be a little confusing, but it's the same bone. For example, look at this bone here. Okay, this is the occipital bone. This is a lateral view of the skull, occipital bone. This is a superior view of the skull where the skull cap has been removed. And you're also seeing the occipital bone, okay? Now in the past, I've asked questions on tests pointing to this structure there, saying, what's this? And, you know, people would say occipital bone, okay? Then I point to this one from this direction, and they don't know. So then later, you know, they ask when we go over the test and all that, it's like, well, that's the occipital bone. And then they go, well, you didn't say it that way. You know, you just showed this, that's the occipital bone, not that. It's like, okay. So as a disclaimer, please know that irrespective of the orientation of the picture or the bony structure itself, the bone is the bone. Whether it's a lateral view, a superior view, an inferior view, and so on. So please, as you're looking at pictures, looking at real bones, and your study time and all that, just know that it's the same bone, and it can be viewed from a different angle. Okay, there's my disclaimer. All right, these are sutures. That's where one cranial bone meets another cranial bone. So do know your sutures. They are listed in your lab handout. This is the coronal suture. It's found in the coronal plane. It's where the parietal bone and frontal bone come together. This is the squamosal suture. And this is where the parietal bone and the temporal bone come together. Okay, occipital bone, where the occipital bone and parietal bone come together, creates the lambdoid suture. That's actually best seen on a posterior view, but you're still seeing some of it here on the lateral view. Okay, zygomatic process. External acoustic meatus. Okay, this is a meatus is a hole, the outside acoustic or auditory. You also may read it in other books as external auditory meatus, so know both. External acoustic meatus or external auditory meatus. Mastoid process. That's where the SCM, sternocleidomastoid, attaches to. Okay, we'll get into origin and insertion of muscles later. But as a teaser to the muscles, and one reason why we're looking at these different parts on bone, is muscles do attach to these things. So there's the mastoid process. Okay, styloid process. The manubrium, this whole thing is the manubrium. Excuse me. The manubrium is your breastbone. This is the mandible, mandibular bone. This is the ramus of the mandible. The hole here, that's a mental foramen. This is the mental area. The chin area is considered the mental area of that bone. Okay, the maxilla. There's the maxilla. Zygomatic bone. Okay, nasal bone. Lacrimal bone. And then ethmoid. Okay, your sphenoid bone. Very, very important skull bone. Here's another view of it. The sphenoid bone. We'll talk more about the sphenoid bone later. Okay, in this view here, this is the ethmoid bone, and the cribriform plate is a plate or a part of the ethmoid bone, and the crista galli is this little mohawk, so to speak, that sticks up. Now in the picture it's hard to tell. When you see a real bone, you'll understand what I mean by like a little mohawk, but that's the crista galli. And the holes that you see there in the ethmoid bone and cribriform plate, those holes that you see there, that's where the olfactory nerves go through. So olfactory is smell. Now we'll learn special sense stuff later, and you'll see the olfactory nerve or cranial nerve 1 and how it sits and goes through those holes and goes down to your nose. Okay, so one of the purpose of holes in your skull, and by the way we call a hole a foramen, is for the passage of arteries, veins, and nerves. Things go through the holes. Well, in that one, olfactory nerves go through it. Okay, the big hole you see here is the Foramen Magnum. There's the Foramen Magnum. Foramen is a hole, magnum is big. The spinal cord goes through that. Okay, frontal view, anterior view, frontal bone, coronal suture, parietal bone. There's your nasal bone. Sphenoid, also you're seeing sphenoid behind the orbit of the eye there. Okay, mandible, and earlier I apologize for that misspeak. That is the mandible and the maxilla. Okay, an inferior view of the skull. So there's your occipital bone, parietal bone, temporal, mastoid, styloid process. Okay, the hard palate is part of the maxilla bone, and so that should be on your list. So make sure you don't let that view confuse you. Okay, the jaw has been removed, which is your mandible. It's been removed. And you're looking at the hard palate. Okay, carotid canal, jugular foramen, which your jugular nerve would, your jugular vein would pass through that. Okay, in this one you're seeing our sinuses. If any of you have ever had a sinus infection, just by looking at the pictures, you can probably relate. Yep, those are inflamed and those hurt at the time, a lot of pressure and so on. Well, there's your frontal sinus, ethmoid sinus, and they're named after the bones that they're in. So ethmoid bone contains the ethmoid sinus, sphenoid sinus, and the maxillary sinus. Now, in a lateral view, you can see that they're pretty deep. They're recessed pretty far back. Some of them are. Okay, so there's frontal. There's the ethmoid sinus, sphenoid sinus way back in there. Maxillary sinus. And the membranes that are in those sinuses can get inflamed and add to the stuffiness and all that misery that can come with a sinus infection. Okay, fontanelle means little fountain. These are the so-called soft spots on a baby's skull. So after birth, oftentimes, you can see this little or feel this little soft spot that's on top of the head. The main one being this anterior fontanelle. The reason for these fontanelles is to allow the baby's skull bones, the cranial bones, to actually overlap each other as they come out of the birth canal. That's actually very good to stimulate brain and neuroactivity. It's good for the lung field to experience that compression and then open up as the baby's coming out. And also they're good for letting you know if the child is dehydrated. And then over time, these fontanelles, they ossify. They start to fill in with bone. Well, calcium, which turns it into bone. Okay, the vertebra, this is an adult vertebra. And at birth, we have about 33 vertebra because the sacrum and coccyx bones are not fused. As you go through growth and development, eventually they do fuse, and you're left with 24 vertebra, your sacrum and your coccyx. Okay, do know that you have 7 cervical, 12 thoracic, 5 lumbar, 1 sacrum, 1 coccyx. Now granted, the sacrum is made up of several different bones. The coccyx is made up of several different bones, but all those have now fused. Now the sacrum in a mature skeleton is 1 sacrum,